Okay, well, let's give this a go, and we'll talk about small animal regenerative therapies. When we talk about regenerative therapies, as you can see on the bottom, the definition of this is the process of creating living, functioning tissue to repair or replace tissue or organ function that's been lost due to disease or damage or congenital defects. And this is a growing field in veterinary medicine. A lot of the information I'm going to give you is validated, known information, but there is still some colloquial information that has been shared by veterinarians, not necessarily validated, but clinically validated. So, again, some of these things we do take with a grain of salt, and other things we are more confident in the knowledge that they have been studied extensively, and there's been research to validate these points. So here are some learning objectives. I want you guys to recognize the fact that there are various types of regenerative therapies that are used in small animal practice. I'm actually going to talk a little bit about some human practices and some equine practices as well, but we're going to focus on small animal practice. I think it's important to understand the pathophysiology and the mechanisms of action of how these cells actually work in the tissue. I think it's pretty fascinating stuff personally. And again, once we understand how and why it works, then we can figure out methods to develop mechanisms for using these things clinically. I am going to present one case study for you of a personal case that I've used stem cell therapy with. Personally, I've been doing stem cell therapy in small animal practice for close to 7 years now, and overall, I'd say it's been a good experience. I think I've seen a variety of excellent results in cases, and some cases that we didn't achieve what we were hoping for. But overall, I feel that the benefits outweigh the negatives in these cases. We'll talk a little bit about platelet-rich plasma, PRP. That is an emerging area and something that I personally have a research interest in as well. And we'll talk about some of the advantages and disadvantages of these therapies. So let's start with some definitions. Totipotent cells these are basically the embryonic cells. These are the cells that when an embryo forms, these types of stem cells differentiate into a variety of tissue that forms ultimately the juvenile in utero. These stem cells can differentiate into pretty much any cell in the body and are stimulated by a variety of genetic factors in terms of their differentiation into which cells they do form. Multipotent cells are those cells that develop into a specific cell type, and these are a little bit more limited than the pluripotent cells, which we'll talk about here in a little bit, but these are basically the adult stem cells and the stem cells that are obtained from the umbilical cord stem cells. These are considered multipotent. And in people, there's been a lot of controversy about obtaining stem cells from the umbilical cord. There's some controversy there as far as ethical issues. In veterinary medicine, we don't have to worry about that. The stem cells that we use are taken from they're all autologous. They're taken from the patient and delivered back to the same patient, whereas in people, there was some research, and I'll be honest with you, I don't really know if it continues to go on, but where they were taking umbilical cord stem cells from one patient and using them for other patients. So again, we don't have to worry about the ethical issues in veterinary medicine with stem cells, and that is something that I point out to owners when I discuss stem cell therapy for their pets. Pluripotent stem cells, these are, again, similar to the embryonic stem cells. Embryonic stem cells are pluripotent in how they develop into stem cell, into various tissue in the body, but again, these are beyond the initial stages of the embryonic stem cells, and that's what differentiates them from totipotent cells. So the totipotent cells are really the early embryonic cells, and then later on in the development in utero, the pluripotent stem cells take over the function. So what are stem cells? Well, basically, these are undifferentiated cells, and undifferentiated meaning that all the stem cells are basically the same, and they differentiate themselves when they develop into different types of cells that are in the tissue. But again, these are undifferentiated cells, and they possess the ability to develop or differentiate in culture or in utero or in the animal, and give rise to the very highly specialized cells that make up the different embryonic germ layers, such as the mesoderm, ectoderm, and the endoderm. And there's basically three varieties. We mentioned the embryonic stem cells in the early development of an animal. A little bit later on, they become the fetal stem cells, the pluripotent cells, and then the adult cells. And we're going to focus mostly on the mesenchymal stem cells, the adult stem cells, because again, that's what we use clinically in our patients, and that's what the research that we're going to talk a little bit about has moved forward with in terms of its clinical use. So again, these are induced pluripotent cells. They're produced by induction of the adult stem cells, and again, we're going to make use of these in terms of clinical treatment of our patients. So, essentially, what do stem cells do? Well, these are cells that do have an unlimited potential for self-renewal, in the sense that they can basically clone themselves or make identical copies of themselves through their DNA. And these are the progenitor cells that do have some limited cycle of self-renewal to some extent, but most of these cells will make identical copies of themselves in terms of self-renewal. In the developing embryo, these do develop into the totipotent cells develop into pluripotent cells, and these are what generate the organs and tissues in the developing animal. There is normal turnover of tissue in animals and people, and it's the stem cells that help regenerate organs. So when we have a patient that has had a large amount of their liver removed surgically, these stem cells will come in and help regenerate these organs along with other cells. When there is damage to tissue, stem cells are part of the process that the body uses to regenerate damaged tissue. And again, there is a normal turnover or apoptosis of cells in the body, programmed cell death. And as cells in the body do degenerate and die over time, it's the stem cells that do participate in the regeneration of the tissue. So, and again, they do retain the ability to become all these types of tissues in the body. Okay. When these cells are activated by disease or injury, the adult stem cells have a variety of different functions. They will differentiate into the various hematopoietic stem cells, which give rise to the red blood cells, white blood cells. Obviously, this takes place in the bone marrow, and these are important for immune function, as we'll see here in a little bit. These do differentiate into the mesenchymal stem cells, and these are the cells that we use clinically. And again, we'll talk about how we use them, but these are the cells that give rise to osteocytes and chondrocytes, other connective tissue cells that we use for functions such as treatment of osteoarthritis, which is most of the time what we're using stem cells for clinically now, but we'll talk about some of the avenues that we're going to be going down in terms of research and other uses for mesenchymal stem cells. They differentiate into neural stem cells, so when there is damage to the spinal cord or to the brain injury, they give rise to the neurons, the astrocytes, and other cells that make up the neurologic system. They differentiate into epithelial stem cells in the GI tract. Again, normal turnover of tissue and cells within the GI tract. These will differentiate and replace damaged cells or cells that are programmed death through apoptosis. And they differentiate into skin cells, epidermal cells, other cells in the body when there is damage to these tissues over the course of the adult life. As I mentioned, mesenchymal stem cells are the cells that we're predominantly going to focus on and look at today because, again, this is what we're clinically using. And these are obtained from a variety of sources, such as the bone marrow, adipose tissue, umbilical cord, etc. But it's actually adipose tissue that has the highest concentration of stem cells in the body. And that's kind of nice because adipose tissue is very easily obtained from patients. It is not considered, vital tissue in the sense that we can take quite a bit of adipose tissue from some patients, and obviously some patients have more adipose tissue than others. And it's readily available. It's usually fairly easily obtained because oftentimes it is subcutaneous or through a limited surgical approach we can get adipose tissue. And it's these mesenchymal stem cells that secrete the various trophic factors. And when we talk about trophic factors, we're talking about cytokines and chemokines that stimulate other functions such as the immune function and inflammatory reactions. And the nice thing is that these stem cells do help to diminish tissue injury and promote neovascularization, which leads to improved blood flow to tissue and improved health of the tissue and development of damaged tissue into healthy tissue again. And in addition to that, stem cells do recruit other stem cells to an area of damage. So when we use stem cells, autologous stem cells, for injection in, for instance, an arthritic joint, the stem cells that we're placing, in addition to providing local function at the damaged tissue, will recruit other native stem cells from the bloodstream or from the body. So they do kind of draw in other stem cells for use in these damaged areas. And again, they inhibit fibrosis. We're going to look at that a little bit as well. So again, we're going to try to diminish scar tissue formation and fibrous tissue formation in the area of damage and promote healthy tissue growing in these locations. So induced pluripotent stem cells, again, have several characteristics, and they have characteristics similar to embryonic stem cells, not completely, and they are derived from individual patient. Like I said, we use autologous or autogenous cells from our patients that we take, and we inject them back into our patients. We're not taking them from one dog and injecting them into other dogs at this time. And again, I'm sure there's research that's ongoing that looks at allogenic use of stem cells. But again, for most of the work that we are talking about, it's autogenous stem cells. And these cells can undergo induction into a variety of different cell lineages. And as you can see, the example on the right, we have adult stem cells that develop into induced pluripotent stem cells. And these will then become induced into a variety of other stem cells, such as mesoderm, endoderm, ectoderm, etc. And the interesting thing about stem cells is that we can actually bidirectionally induce these. And what does that mean? That means that stem cells that have developed already into specific tissue type cells can then dedifferentiate or go backwards to these induced pluripotent stem cells, which can then dedifferentiate back to adult stem cells. So the induction of these cells can work in both direction. And, it's an interesting fact of stem cells that they do this. And in terms of, the clinical applications of this, I personally don't know of any, but it is something that from a research standpoint, you can take tissue and dedifferentiate them, the specific tissue, back to mesenchymal stem cells, and then have those cells to use elsewhere. So, and again, that's what we're talking about with adipose tissue, is that there is a high concentration of stem cells in the tissue, but it can also be dedifferentiated back into adult stem cells. And that is actually something that we use clinically, in the sense that when we have a patient that we've obtained adipose tissue from and we've extracted all the stem cells from that sample, we're not out of stem cells as long as we've retained the adipose tissue, because then we can then reculture or de-differentiate the adipose tissue back and obtain more stem cells for use later on in the animal. And that is something that we do use clinically in patients as of right now. So essentially there are 5 main mechanisms of the mesenchymal stem cells. There's the trophic support, and again, this is due to the growth factors and cytokines, which we'll look at here in a little bit, that are secreted by stem cells and are used to recruit other cells in terms of using them for reducing inflammation and for tissue repair. They are anti-inflammatory, and again, this is due to the cytokines that are released from stem cells. They differentiate into other tissue, as we mentioned before. They do have the ability to home to an injury site, and this is due to the recruitment of other stem cells by stem cells at the site of an injury. And they do modulate the immune system, as we'll see here in a bit. As far as trophic support, stem cells do release growth factors or a variety of cytokines, and as you can see on the right, mesenchymal stem cells do secrete all of these different cytokines, such as the interleukins, the vascular endothelial growth factors, the interleukins, fibroblast growth factors, etc. And then these cytokines do have an impact on other cells within the body that have these variety of outcomes, such as an anti-scarring effects by the matrix metalloproteinases, angiogenic benefits of inducing new blood vessel growth by vascular endothelial growth factors, anti-apoptotic cells, which block cell death after injury, so it prevents further damage or death to an organ or tissue. And like I said, stimulation of other stem cells, bringing more stem cells from the body to the site of an injury. They have an anti-inflammatory effect. And basically, I'm going to simplify this by saying that the stem cells will decrease pro-inflammatory mediators, so any of the mediators of inflammation that are produced by injury, stem cell will decrease those mediators, such as the tumor necrosis factor alpha, interferon gamma. And they also increase anti-inflammatory mediators, so by providing interleukins to reduce inflammation. So they decrease the mediators that are causing the inflammation. They increase the mediators that are anti-inflammatory. That's the simplified mechanism of how stem cells work there. And again, this is mediated through cytokines and chemokines. As I've mentioned before, stem cells differentiate into a variety of tissue, and this is done either embryologically or due to injury. And again, stimulated by bringing other stem cells into the fold, and also through cytokine release to the tissue around it. So let's look at a typical injury response, and let's look at how stem cells reduce inflammation. This is a standard cascade of events that happen when there's an injury. So again, once there is injury, we get an immediate spike in the inflammatory response, which over time will subside. And while that inflammatory response is ongoing, we already start to get some degree of tissue repair or damage, even in the face of ongoing inflammation. So we do get neutrophils and monocytes that rush in, that help reduce inflammation and clean up the area of damage. And it's a low-level response compared to the inflammation, but it's more, but it lasts longer than the acute inflammatory response. And then over time, we get fibrosis and we get tissue that forms scar tissue at the site of an injury. And again, this is kind of the end result of damage to tissue following inflammation and then repair. Now, using stem cells for a site of injury, we can, as we showed before, reduce the inflammatory response and speed up the regeneration and healing of tissue. So the end result is that the inflammation noted at the site of an injury is less. By autogenous stem cell treatment of an injury. We can promote regeneration of that tissue, and the end result of that is that we have a reduced scar tissue formation and less fibrosis present. So again, by blunting the inflammatory response and stimulating the regeneration of tissue response, stem cells work very nicely in the face of injury in that regard. These are some slides showing stem cells that have been tagged with radioisotopes and looked at to demonstrate that at the site of damaged cartilage, stem cells do actually migrate to the area of damage. So this demonstrates the homing mechanism of stem cells to the site of an injury, where they then go on to reduce inflammation and induce repair. So again, this is just some histopath slides that demonstrate stem cells homing to injury sites. And then as far as the immune modulation, again, there have been some research, and in people, multiple sclerosis is an immune-mediated disease. And patients with MS who have been treated with stem cell therapy have seen some improvement and decrease of the immune response. Or improvement in the immune response and decrease of the immune-mediated changes that are occurring with MS. So again, demonstrating that there is some immune modulation for patients with stem cells. So again, those are the things that stem cell therapy can do in clinical application. So how do we use it in small animal treatment and in veterinary medicine? Like I said, the predominant method of use of stem cells clinically in small animals at this time has been for patients with chronic osteoarthritis. And again, majority of the work that I've done over the last 7 years has been for patients with chronic osteoarthritis. And we'll talk about a few of the other methods that I've used stem cells for here as well. But chronic osteoarthritis is such a big field, and the management of it is such a big field that stem cell use has really offered us something as another option for treating these patients. And I've personally seen excellent results with most of the patients I've treated this with. So, but we can also use stem cells for dogs who will likely develop osteoarthritis. And it's not that we're actually using the stem cells at that time, but for instance, if you have a puppy who is a breed such as a Lab or a Golden or a Rottweiler that you do suspect will develop osteoarthritis later in life. As I mentioned, we can obtain stem cells from adipose tissue. So if you're going to spay or neuter one of these patients, you can obtain adipose tissue very early in life and then bank that tissue for use later on. And as I said, we can de-differentiate adipose cells back to stem cells. So labs will actually, by freezing them, will bank tissue cells for years. And so as that puppy grows and develops, and when it gets to be an adult dog, if they do develop osteoarthritis, we can then use the stem cells that have already been harvested from that patient for treatment of their osteoarthritis. So again, this is not for every dog. These are for dogs that we identify who are high risk factors for developing arthritis later on in life. You may have, for instance, a Labrador who does have some hip laxity or some early signs of hip dysplasia, which likely will develop to arthritis later on. And when you spay or neuter that dog, we can take adipose tissue samples, bank them for years, and then when that patient is clinically affected later on, well, we've already got the stem cells and we can treat them later on. There is some ongoing research in cats looking at stem cells for tissue repair in patients that have acute and chronic renal disease, and that's actually progressing along very nicely. I'm not aware of any clinical use that's widespread at this time. There are still experimental uses for it, and there's been some papers that have been published on this as well, so that's something to keep your eyes open for future use as well. And the same for patients with chronic hepatic disease, dogs who've had liver disease. And again, some of this information is colloquial, which I will share a personal case that I used it with. I had a dog that had chronic osteoarthritis. We had taken some adipose tissue, some mesenchymal stem cells from this patient. A few years later, he did develop some pretty nasty liver disease and developed a liver abscess that really caused some damage. And we had stem cells available for this patient, which we then used intravenous. And the thought was that the stem cells would home to the site of the injury in the liver. Several weeks later, we rechecked liver enzymes on this dog, and they had come from very, very high elevated to practically normal. And it is possible that the stem cell injection that we used may have contributed to the improvement. Obviously, there were other treatments. That wasn't the only treatment that we did, but it was a very profound effect in terms of the changes in the liver enzymes getting back to normal. So, and again, I had spoken with the people at VetStem, the company that I worked with in terms of harvesting stem cells and getting them de-differentiated back from adipose tissue to stem cells, and they suggested that we try it, which we did, and we got a good effect. So again, that's just colloquial information. I have no research to back that up, but it was something that we tried, and I know that other people are doing things along the same lines. So again, there are options such as that for treatment once we have stem cells from a patient. So in terms of the patients that we use for selection for osteoarthritis, there are several factors that I consider an ideal candidate. Certainly a patient with very clearly defined lameness that's due to osteoarthritis. Now, if they have a cruciate ligament tear, for instance, they probably do have some arthritis. You still have to fix the cruciate. You can use the stem cells later on to supplement the reduction in the inflammation from secondary to the cruciate injury. But if they have, surgically amenable disease, such as a cruciate tear, you still do have to repair that surgically. Patients that have severe osteoarthritis radiographically don't always respond as well. Now, I've tried it on patients with severe arthritis, and I've been pleasantly surprised by how well some of them have done, but others not so much. Patients with early arthritic changes or mild to moderate changes that we see radiographically are definitely better candidates for this than severe patients. So with severe patients, you can try it, but they still do need other treatments such as glucosamine and NSAIDs, things like that. Patients with more than about one or two joints that are affected, it may be unrealistic to expect them to be, significantly improved. So if I have a patient with bilateral stifle arthritis, bilateral hip arthritis, and maybe some arthritis in the elbow somewhere, that may be a bit much to expect that patient to improve clinically. But if I have a dog that's got, for instance, bilateral hip dysplasia and no other major injuries to the joints, and they have arthritis in their hips, that might be a reasonable candidate for treatment with stem cells. We do worry about patients with other systemic diseases. And again, if they have renal disease, if they have hepatic disease or other injuries, well, it may be questionable as to whether or not we treat those patients or not. But as I mentioned before, we are, getting more information every year showing that we may have to rethink that, and in the face of other systemic diseases, still continue to treat with stem cells. So this comment about no major spinal disease, these comments do come from VetStem, the company that probably the biggest company nationally that we work with in terms of stem cell therapy. But there have been some case reports about patients with, for instance, intervertebral disc disease that were also treated with stem cell therapy in hopes of regenerating some of damaged cells in the spinal cord or in the neurologic tracts. So again, this is an area where more research is needed, and we don't know whether or not there is an impact of stem cells at the time of, for instance, hemilaminectomy for some of these patients or not. Usually these are patients that are on NSAIDs, and we do have to rethink whether or not to continue with NSAIDs at the time of stem cell treatment because, again, there needs to be some inflammation present for stem cells to have their anti-inflammatory response. And it's not to say that NSAIDs are going to completely remove the inflammation and take away the impact of the stem cells, but I'll be honest with you, most of the patients that I've treated with osteoarthritis with stem cell therapy are on NSAIDs because it's hard to get them off. However, quite a few of these patients we've been able to either significantly reduce the amount and frequency of NSAIDs that they're taking, and in several cases I've actually been able to get patients completely off NSAIDs following stem cell therapy. So again, something that, again, is more due to each individual patient's affected disease, whether or not we treat them with NSAIDs or not. And one of the things it's really important to do is to give the owner realistic expectations. We may reduce inflammation, we may improve these candidates clinically, but it's unrealistic to expect that these dogs are going to completely go back to normal. We're not going to completely regrow normal joints and normal cartilage and, take away osteophytes that have already developed there. That's not what we're doing. I look at stem cell therapy for dogs with osteoarthritis as another means of reducing inflammation. And that's how I present it to owners. So I don't tell them they're going to be normal. I certainly would never promise something like that. But many of these patients do go back to a very sound, normal activity level, and owners at that point are always pleasantly surprised. So, in terms of harvesting adipose tissue to obtain mesenchymal stem cells, there's a few locations that we can get adipose from. Falciform ligament. Again, if you're going to do a spay, you may have to extend your incision to get to the falciform, or you can make a small keyhole incision in the abdomen and remove the falciform ligament. But there's a very high concentration of mesenchymal stem cells in falciform fat, so that's a nice location. Certainly, if you have a very lean dog that doesn't have a whole lot of body fat, there typically is the falciform fat present. So again, for dogs that are very thin, that don't have a lot of generalized body fat, the falciform is a nice place to go, or certainly if you're going in the abdomen for any other reason, we save the falciform fat. One of the areas that I commonly take adipose tissue from is caudal to the scapula along the lateral thorax. Right behind the scapula, about the level of about the first or second, where the first or second ribs would be along the lateral thorax, there is a very large deposition of adipose tissue in that region. And honestly, there are some surgeries where we want to get fat grafts from to delay bone healing, such as ulnar osteotomies or ulnar ostectomies, that we also will use this location to harvest adipose tissue. And there's actually a fairly large concentration of fat there. Typically, for stem cell therapy, we have to obtain about 60 grams of fat. This little tube that you're looking at here in picture number 3 in the bottom left does contain phosphate buffered saline and holds about 30 grams of fat. So we try to basically submit 2 of those vial fulls of adipose tissue with the PBS and send those off to VetStem, and that's what's used to derive mesenchymal stem cells from. Now, in terms of regenerative therapy, in addition to mesenchymal stem cells, there are other methods, such as autologous conditioned serum or interleukin receptor antagonist proteins, IRAP. This is used more frequently in horses than it is in small animals, and personally, I'm not familiar with ACS or IRAP being used in small animals. platelet-rich plasma, PRP. I use a lot of PRP, and we'll talk about that. And like I said, stem cells can also be obtained from bone marrow in addition to the adipose-derived stem cells. And it's my understanding that in horses, they will obtain stem cells from bone marrow from the sternebrae is a location where in horses I do know they derive them from, but in dogs it's pretty much all adipose-derived stem cells. But in horses, like I said, they will get them from the sternebrae, they'll get them from the crest of the ilium, from other locations, the humerus and tibia as well. With bone marrow derived stem cells, it is a little bit more work in terms of the lab isolating stem cells, and they do have to do some more types of processing in terms of expansion of the stem cells, whereas with adipose-derived stem cells, there are a large number of mesenchymal stem cells in the adipose that we can just pull out right away and then expand the tissue later if we need more stem cells. But with bone marrow, it's more of an expansion of the stem cells rather than pulling out a large number of stem cells from the sample right away. In horses, it is also shown that bone marrow derived stem cells do decrease in number as the horse ages, whereas with canines and adipose derived stem cells, that has not been shown. So the advantages of adipose-derived stem cells is that they're much, much easier to obtain. Again, we're talking about a very small incision for the lateral thorax. It's basically just a skin incision, and we're right there, whereas with falciform, we do have to go into the abdomen to get it. Bone marrow aspirates to obtain stem cells are technically a little bit harder. We do get a higher cell count with adipose-derived stem cells, whereas with bone marrow, it does take a number of expansions to get the number of stem cells needed for treatment. And as such, adipose-derived stem cells are less expensive because it doesn't have the associated lab costs of expansion. And then with adipose-derived stem cells, it's a much quicker turnaround, usually within about a day or two, up to 3 days after surgery to collect adipose tissue. We'll have our stem cells ready for injection, whereas in horses, or if the technique of getting bone marrow derived stem cells, it may take up to a month before we have the cells ready for injection. In horses, there's a variety of different applications. They'll use it intra-articularly like we do in dogs. To my knowledge, there's not been any controlled clinical trials in horses. There's only a few in dogs that have shown benefits, but in horses, it's my understanding there haven't been anyone. They also will use it for treating tendinitis and desmitis, and we do use stem cells for treating tendon injuries such as biceps tenosynovitis or supraspinatus injuries in dogs. It's also actually been used for calcanean tendon injuries to supplement repair, surgical repair to speed up healing. But in horses, they are prone to develop a lot of tendon injuries. And so mesenchymal stem cells have been used for that benefit as well, to reduce tendinitis in horses. And then it's also been used topically in horses for wound healing and try to decrease sarcoid formation and proud flesh that forms in these horses, and try to reduce some of the scar tissue that forms in these guys as well. There are some concerns about safety with stem cells. Initially, when we started using stem cells in people and animals, there was a concern that the stem cells would induce other tissue to form, and basically forming teratomas. And the outlandish concern that we take stem cells, we're going to inject them into a dog's joint, and then all of a sudden these stem cells form liver cells or something crazy like that. There has been some research in this, and it does show that in certain locations, stem cells can form abnormal tissue other than having the desired effect of reducing inflammation and rebuilding damage to joint capsule and cartilage, things like that. But for the most part, this has not really been a problem at all. That said, patients with neoplasia, currently who have neoplasia and are being treated for cancer, it's not recommended to treat these guys with stem cells because of some concern that it could promote induction of neoplastic tissue in other locations. So again, there is some concern with this, and again, it's mostly for patients who have ongoing cancer at the time. Obviously, we're processing cells and then we're injecting them either IV or intraarticularly, so there is concern about infection and complications in lab processing, which do occur. It's a very, very small percentage of cases, but it is something that we do watch for any signs of infection following stem cell injection into a joint. And then again, whether or not there are inducing any immunoreactive products, because again, canine stem cells are processed using fetal bovine serum in culture media, and there is concern that we may produce an immunoreactive process secondary to any fetal bovine serum cells that may, or serum that may linger in the stem cells we're injecting, and for the most part, this has been a very, very minimal concern. Looking at autologous conditioned serum, and again, like I said, this is something that's done more in horses and it's in small animals. It does take advantage of the interleukin-1, the anti-inflammatory response to interleukin-1, and in terms of patients with osteoarthritis, it is produced by taking monocytes that in whole blood and to increase their production of interleukin-1s. And so again, this is stimulated by the stem cells themselves, releasing various cytokines and inducing reduction in inflammation secondary to that. But again, this is something that's done a little bit differently and is not currently done clinically in small animals. To get this, to do this process, blood is drawn using a venous sample. They do expose whole blood to a variety of glass beads, and it enhances the production of the interleukin-1. And again, this is then used to upregulated in patients with osteoarthritis, and is treating these patients with this. I'll be honest with you, I don't have a great deal of information on how this is used, but in horses it is used a little bit more. But again, just wanted to introduce you to these other options that may eventually develop down the road into something that we use clinically in small animals. PRP, we do use a lot of this in small animals, and basically what this is a blood sample that's been concentrated down to obtain a very concentrated level of platelets. And the analogy that I always look at is it's similar to looking at the Buffy coat in a crit tube. When we spin down a crit tube, we end up with a sample with red blood cells are heavier, and they end up at one end of the crit tube, closer to where the clay is. The plasma ends up at the it's not as heavy as the red blood cell, so it ends up closer in the centrifuge, and that's what we look at to get our total solids from. But it's that little sample in the middle, the Buffy coat, because the platelets aren't as heavy as red blood cells, but they're heavier than plasma, so we do get an accumulation of platelets here in the middle, like we would for the Buffy coat of a crit tube, and that's where the platelet-rich fraction is, and that's essentially what we're looking for and using, and this is the platelet-rich plasma section. Now, it's done several ways. It can be done by centrifugation of tubes, but it also is done by filtration too, which we'll look at here in a little bit. And the reason why the platelets themselves are important is because platelets do contain a variety of different growth factors, such as TGF beta, PDGF, VEGF, all these that stimulate tissue healing. They stimulate angiogenesis and mitogenesis of cells into healthier tissue. And they also do activate macrophages. So macrophages do come up and clean up the area where tissue has been damaged. And they accelerate production of collagen and other cells for areas where there's been injury to bone. And again, there are some reports of using PRP at the site of fracture healing as well to help try to stimulate repair of fractures and production of collagen and then migration of osteoblasts to lay down new bone formation. So again, a lot of variety of ways people are using PRP. It can be used intralesionally or topically for treatment of different musculoskeletal injuries. And again, I do use PRP at the time of repair of calcaneal tendon injuries. So if I'm fixing a calc tendon that's been ruptured, I will try to get a blood sample from that patient preoperatively, spin it down or filter it, get the PRP, and when I'm done doing my repair, I inject the PRP at the site of the surgical repair in hopes of stimulating or speeding up healing of the tendon that's been damaged. Like I said, this takes use of the fact that platelets are a good source of growth factors, chemokines, and cytokines in the body, and they do work in conjunction with stem cells when injected together to help promote anti-inflammatory effects and enhance tissue healing and wound repair. So again, PRP does have a direct effect on tissue and cells through mitogenesis or chemotaxis. They do produce a number of chemokines and cytokines that stimulate monocytes, neutrophils, other anti-inflammatory cells to or other inflammatory cells to come to a site of tissue damage and have their effect. They do secrete these growth factors over the period of several days, even up to a week. The most intense time of secretion is usually within that first hour of an injury, but they do continue to release growth factors for several days. There is no concern about mutagenic activity because they don't act on the cell nuclei. They do release chemical mediators that stimulate other cells to come to the site of injury. So there's no concerns with using PRP for possible induction of tumor formation. To get the PRP, like I said, there's a variety of different commercially available kits. There are labs that will do it. It's usually done in-house because, again, stem cells a little bit more processing to do that. There are some benchtop stem cell processors, but most of the time the adipose tissue is sent out to labs that do prepare the stem cells and then also bank the tissue for future injections of stem cells. But PRP is oftentimes prepared in-house. It can be done either through centrifugation or kits. I personally prefer a kit that's produced by VetStem, which is a filtration system. And these are a number of the types of kits that are involved. Like I said, they're done by centrifugation. This system here in the upper right corner, this is the VetStem system where blood is placed in a bag. It's then filtered through a membrane here, and the non-platelet portion of the blood ends up at the bottom, and it's this area here that we then flush and obtain the PRP for further use. So again, that's my personal favorite. And in terms of how do I use it, like I said, I do use it for patients with tendinitis or desmitis. We will use it as an ultrasound-guided injection for injuries such as biceps tendinovitis. I will inject it open for patients with calcaneal tendon ruptures, or if I am doing surgery on an area where there has been tendon injury, I will inject it there as well. And again, we're taking advantage of the variety of growth factors that are going to be released into that tissue to stimulate healing and reduce inflammation and decrease scar tissue formation. For patients with osteoarthritis, we inject them at the same time we inject the stem cells. And they basically are used to help reduce inflammation with the stem cells. As I said, they do release a variety of different cytokines, which induce inflammatory mediators to come to the site of the injury and reduce the inflammation at the site where stem cells have also been injected, and the stem cells are recruiting other stem cells to come in and reduce inflammation. Now, in terms of guidelines, in terms of how much to inject and how frequently we inject, that's not really been established yet to my knowledge. And again, like I said, a lot of this is somewhat colloquial or secondhand information without actual science behind it to validate it, other than the fact that clinically, under clinical trials, these things do seem to work very well. But for right now, we don't have any specifics in terms of how often do we use it. My personal feeling is I use it and watch for an effect. And if I do get benefit and effect by the patient showing decrease in inflammation, when that inflammation then starts to return, because again, we're not curing the inflammation from arthritis, but when the inflammation does start to return and it gives me evidence that the anti-inflammatory effects that I'm hoping for are starting to subside, then I retreat at that point. And with stem cells, it can last anywhere from 7 to 9 months. And with PRP for tendon injuries, I've seen effects last anywhere from 6 to 8 months. So they can last quite a long time. And again, I use their clinical, their clinical effects as my guidelines in terms of when do I retreat. So most of the work that I've actually done with PRP has been for supraspinatus tendon injuries. Again, that's the muscle that's cranial portion of the scapula, and it inserts across the shoulder joint at the proximal humerus. It runs in a fashion anatomically similar to the biceps tendon, and a lot of times biceps tendon injuries have been diagnosed and they're actually supraspinatus tendon injuries, or we'll see them both concurrently. This is a paper that was published, I think it was published a couple of years ago, where they looked at 55 dogs with supraspinatus injury which have been injected with both stem cells and PRP. And the conclusion they came to was that dogs that were treated with this type of therapy did show a clinical improvement. So it does validate the fact that these are having a positive impact at the site of injury of these tendon injuries. So again, I've been using PRP and PRP stem cells for these types of injuries for quite a few years, and I've been very, very pleased with how well it's worked. I've seen very few, if any, I can even remember, but very few to no lacks of response. I've seen positive response in pretty much all the cases that I've worked with. Now, in terms of how long does that response last, there is some variability with that. The PRP and stem cells do have to be injected with ultrasound guidance, so we make sure that we're getting it at the site of the inflammation of the tendon. In terms of future direction for stem cells, well, I kind of alluded to a few of these things as well. I think there's great applications in the future for treating patients with spinal injuries, especially, the typical dachshund who's ruptured a disc and then has some damage to the fibers that go through the spinal cord and the neurons in those locations. I did mention acute and chronic renal disease in cats. That's an area of ongoing research. Hepatic injury. The liver is such an active area in terms of tissue regeneration. You have to believe that there may be some future direction for us to use stem cells for treating liver injuries. Interestingly, a lot of the research that's been done in stem cell therapy is done by dentists, and there are actually a tremendous number of stem cells present in the roots of teeth, which is a location where they will derive their stem cells from. So there's a lot of research ongoing through human dentists in terms of I don't know if regeneration of teeth is actually the best term, but using stem cells for a variety of different dental benefits. I mentioned accelerating bone healing. We do know that PRP will stimulate the production of collagen to form and osteoblasts to be induced to come into a site of injury. So that may stimulate some bone healing. So there's certainly a lot of applications in the future for that potentially. And ophthalmic applications. Ophthalmologists, again, in human field have looked at stem cell use for corneal injuries or corneal damage. So again, possibility of healing of those tissues without scar tissue formation or regenerating corneal tissue. Allogenic stem cells, where we take stem cells from one patient and place them in another. I mentioned earlier that is a source of concern among ethics in people. I actually participated in a multi-center clinical trial a few years ago where we were using allogenic stem cells. Unfortunately, the results of that weren't as positive as autogenous stem cells, but there is an area of work for that. The advantage there is that it does not require any surgery to obtain the stem cells. Literally, you can just pull a bottle of stem cells off the shelf or out of the fridge, drop some and inject them into a patient, and that would be theoretically the advantage to doing that. So again, some work still ongoing by VetStem with that, and again, use your imagination. What can we use stem cells for? And again, there's a tremendous amount of research going on all over the world looking at stem cell therapy for a variety of applications. Let me talk about a case right now. This was Maxie that I saw quite a few years ago. I first saw Maxie in 2008. Maxie is a 13-year-old male-neutered dachshund as of 2010, this was. But I first started seeing Maxie when he was about 11, and he was diagnosed with chronic bilateral shoulder degenerative joint disease. And he had a very difficult time walking. We were treating him with NSAIDs, glucosamine, weight loss, all the variety of things you would normally treat an osteoarthritic patient with. This is Maxie's lateral shoulder rads, and you can see these large osteophytes that had formed bilaterally off the caudal aspect of his humeral head. And so he was diagnosed with bilateral shoulder injury. When Maxie walked, he took very short, choppy steps with his front legs. His shoulders just hurt, and owners were looking for some options. So we treated him medically for about 2 years, and it just wasn't working. He was still painful. In about 2010, I discussed stem cell therapy with them at that time. So I had just started doing stem cell therapy. So I guess I've been doing it about 10 years. But I started, he was actually the second case that I ever did, so I remember him in that regard. So around 2010, we discussed stem cell therapy with him, and owners wanted to try. September of 2010, we did an adipose tissue collection and collected stem cells from him. And then 2 days later, we injected his shoulders. I saw him again 12 days post-injection, and he was walking normally at that time, which was a pretty profound response for him. And it's not atypical in some of these stem cell cases for dogs with chronic arthritis when they're not horribly severe. This is what I've experienced a lot of. By the time we take the sutures out from the surgery site to collect where we've collected adipose tissue, we typically inject patients 2 days post-injection because it takes 2 days to process them. And then I usually see them back about 2 weeks post-operatively for the suture removal and to recheck them. And I would probably say about 80 to 90% of the patients I've treated by the time we get to that suture removal 2 weeks post-op are pretty sound, and they're at least improved, I should say, not necessarily sound. But Maxie was great. Owner said he was running, he was playing, he was jumping. He felt so good that 6 weeks post-injection, he jumped on her other dachshund, and the other dog herniated its disc. That's how good Maxie was doing. So this was a very expensive stem cell treatment. Now we had to do surgery for her other dog's ruptured disc. Maxie did well for about 7 months post-injection, and the owners noted he was starting to slow down a little bit. So We re-injected both shoulders at that point, and within a few days, he was back to running around, feeling really, really good. And that lasted for close to a year. 11 months later, he was sore again, having difficulty with his front legs. We re-injected both shoulders at that point. He had a great response. Oh, by the way, their other dog did well after disc surgery. But 2 or 3 days later from Maxie's third injection, he was doing great again, running around, jumping, doing everything really well. And we were injecting him about every 8 months thereafter until about October of 2013 when he was 16 years old. He developed lymphoma, was treated by an oncologist, didn't really have a response to that, and he was euthanized at that point. But the owners felt that the last 3 years of his life, he was considerably more comfortable on his shoulders and certainly less painful. We debated whether or not his lymphoma at that point was due to the stem cell injections he had received. I do feel it was unlikely since it was more of a systemic problem rather than a localized response. And again, the stem cells that we inject are intra-articularly, and for the most part, they stay in the joint capsule. Of course, they could migrate elsewhere, but for a 16-year-old dog to have developed lymphoma after 3 years of treatment, I think it's unlikely. I think he probably would have developed lymphoma anyway, but we don't know that for sure. So anyway, here's your take-home points from this. I think that there are a lot of different regenerative therapies that we can use for a variety of tissues and injuries. Most of the concepts and things that we're using stem cells for have been extrapolated from the human literature. There has not been a lot of clinical stem cell case reports out there, but they are starting to come out now after years. I personally find this an exciting area. I think the research that we do find in this field is fascinating, and I think there is a huge horizon for us in terms of what can we do later with stem cell therapy. There is still, unfortunately, a lot of anecdotal information out there which hasn't been proven, but veterinarians and human MDs, we're trying different things and trying to help these patients based on the knowledge that we do have of what stem cells do. I think that adipose-derived stem cells are the future rather than bone marrow-derived stem cells. They're certainly easier to obtain and less expensive, and have a very good benefit for our patients. There has been some concern about USDA approval of stem cell usage in food animals. And there's also been some concerns amongst patients that have insurance, whether or not they will pay for stem cell treatment or not as well. So a lot of issues to still be sorted out over time. And I think over the course of your guys' careers, you will see this becoming more of a mainstream application for certain treatments. But anyway, if you guys have any questions about anything that I've talked about in this lecture, please email me. Any questions that I receive, I will disseminate out to everybody so that everybody can hear the response to it, though. But if you have any questions, let me know. Otherwise, I will see you guys in lab, and let me know if there's any questions or concerns with how this lecture turned out. It's my first time doing it online. So, anyway, we will see you in lab.